Hello, I'm Tate Shanafelt, Professor of Medicine at Mayo Clinic, and I'm here to describe an article that we will soon be publishing in the Mayo Clinic Proceedings entitled The Impact of Organizational Leadership on Physician Burnout and Satisfaction. We undertook this study because there has been a profound change in the work environment of physicians over the last 30 years. Over 75% of physicians are now employed by large healthcare organizations, which is a large change from the historical single specialist or multi-individual small group practice that physicians practiced in the past. And with that change has come a number of new responsibilities for physicians. It's required them to sacrifice some autonomy, to be responsible to productivity expectations set by the organization, and to be accountable to organizational leadership. And we wanted to look at how leadership behaviors of physician supervisors impacted physicians' well-being and satisfaction. What we found in the study was that there was a very strong relationship between the leadership behaviors of physician supervisors and physician satisfaction and burnout. I think on a simple level, leadership matters. Each of the nearly 3,000 physicians responding to our survey rated their physician supervisor in 12 specific dimensions on a 1 to 5 scale, asking about specific behaviors of their supervisor. And what we found is that on multivariate analysis, adjusting for age, sex, duration of employment, and specialty area, that each 1 point improvement in the composite leadership score on that 60-point scale correlated with a 3% reduction in burnout and a 9% improvement in satisfaction. We also found that at the work group level, that if you took the aggregate average score of a leader as calculated by all the physicians reporting to them, that at the department level, about 10% of the variation in burnout across departments and 50% of the variation in satisfaction was attributable to the leadership score of the division or department chair. And I think what was also most important is that the leadership behaviors that were being assessed are actionable and teachable behaviors. The effective leaders kept their physicians informed. They helped individuals develop professionally. They provided objective feedback. And perhaps most importantly, they asked physicians for their ideas and suggestions on how to solve the problems affecting the local work unit, and then empowered the physicians to actually implement those solutions. And I think those are behaviors that can not only be taught, but they're the behaviors that engage physicians and help them connect with their work and with the organization. Although all the physicians in this study were working at Mayo Clinic, I don't think that the findings are unique to Mayo Clinic, or that good leadership is only important to Mayo Clinic physicians. I think these are the behaviors that help physicians in all settings engage and bring their talents and energy to helping the organization succeed.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.